You know, build that relationship up through their prenatal sessions, and you'll see how much they can handle. So she's complaining about her glute. It hurts right in the middle, right? That's what you're saying? Okay. She's in a point. So right around the SI joint, you got, all through the bone through here, a lot of nerves run through that area. So, you got your SI joint issues, the ligaments starting to get stretched from the belly growing. And we also got the piriformis, sciatic nerve, all that running down the leg can cause some issues. So let's get started. If you don't mind, please subscribe to the channel. That'll help us out as a small business. And if you have any comments, concerns, or anything, or just want to say great video, that works too. Just comment below. All right, so a lot of times I have the prenatal pillow that allows them to lay face down. This one we're going to do a sideline technique, so I'd like to do a little bit of active release. And she's probably like, what, you're going to make me do something? But first things first, I like to do, when I do any prenatals, I like, she's already given permission to move her underwear and all that stuff. So, I think it's really important to get the inflammation away from the SI joint. So I like to push away. Is that a little tender?
No, feels good.
It feels good, see. In general, and normally my table height's a lot higher, but this, for the sake of this video, we were doing it pretty quick, so I didn't raise it. But I like to put, like I said, push a lot of that tension away from the SI joint and do it all the way down. If you have lower back pain and you get worked on, you usually know what I mean by it really feels good when they get through here and start just pushing away all the way through right next to the bone. I like to use a fist, some knuckles. Yeah, it can be a little tender, but it also feels pretty good. How's that feeling to you?
Good.
One also thing with Sideline that I really like is it gives better access to the QL muscle, quadratus lumborum. A lot of people have issues with lower back pain, have that issue. So I'll show you a technique in a minute after we warm it up a little bit, getting the blood flowing. All right. What I like to do is I like to put my forearm and line it up right next to the bone. So alongside, I'll stand up so I can get a little bit of leverage. And how's that pressure? Too much? You want more or less?
Oh, it's good.
Okay. Does that feel like it's an area that's bugging you?
Mm-hmm.
Okay. She's going to really notice it when we get into the piriformis area. She's like, I don't know how I feel about that. Okay. Now we're going to drop a little bit lower. I'm using the blade of my ulna rather than just straight elbow. A lot of, at least my prenatal clients, one complaint they have with certain massage therapists is the therapist seems to be afraid to get enough pressure. It's like they're fragile or something. As long as you wash it out really good, push the blood flow through, you're pretty good with doing trigger point. Now, I'm also going to do an active release too in a minute. How are we doing? I think she feels it.
Mm-hmm.
Is that shooting down or is that okay?
Yes, it is. But it's fine.
Okay.
I feel like I need it that way.
Yep. So what I like to do, as you'll see, is right around here. If you want to see where I'm at, I'm kind of right here in the glute. I'm going to lean down into it. And then I'm going to have them actually bring their knee up towards the ceiling. And relax it. There you go. Now, I wouldn't maybe do this on the first time prenatal, like the first time you see them. Maybe, work your way into that the sessions to see what they can tolerate, how their body responds. She's gotten a few of them. That's the benefit of working at a massage therapy place. So bring her, do it again. So what we're doing, let's go down, is getting right on that trigger point, you know, and having them activate that muscle. Sometimes it's also a way to point out to clients that they need to strengthen their glutes. She's like, are you talking about me?
Mm-hmm.
Good. All right. And I would, you know, do this on both sides, but typically our right glute tends to be a little bit weaker than our left one. So we want to, and then you get a lot of pelvis issues with if it rotates anteriorly on the right side. So working all this area. Does that feel a little looser than it did when we started?
Mm-hmm.
She's like, for the sake of the video, I'm going to say yes. But no, it really does. I can feel a little bit more movement. Remember, right now I'm kind of pushing the blood flow through. Use your palm if you want. Make sure, you know, especially if you're a female therapist, make sure you lunge into stuff. You know, use your legs. Don't try to manhandle it with your arms. I mean, those are your money makers. We don't want to injure them. All right, next we're going to do is I'm going to hit on their QL. So what you'll see the hip lines right here, that bone. You know, you can kind of work along it like this. It can be pretty tender for some people, so just watch out. How's that feel to you?
Good.
Okay. In general, I mean,
Maybe it is a little tender.
okay. Now that you say that. Now, for someone who's not pregnant, you know, she's 25 weeks, but for someone that's not, I like to really get a forearm right in here and just kind of sink into it and have them just take deep breaths. You can check out one of my other videos for some lower back and hip techniques. Shame on me, I don't know. I don't remember which one that title was for that one. So, and like I said, we're always come back to that sacral area. Push all the tension away. All right, and then what I like to do, I mean, you may have seen one of our videos. It's a stretching technique for the prenatal. So what I want to do is grab their top leg, which is the right leg, and I'm going to sit behind them right where their SI joint is, and I'm going to grab right here, and I'm going to pull backwards, and she's going to tell me right when she feels it.
Where should I feel it?
Right in your quad and your hip flexor. What I don't want is I don't want them to feel it in their lower abdomen.
Okay.
Okay. Kind of feel good?
Mm-hmm. Just gonna stretch.
Yeah. And you can actually resist that. So push towards, there you go. She's going to push kind of away from me towards her face. So, and then, so I try to, what I do is I get them as far as I can this way, and then I start to bend the knee. If they have knee issues, don't, you know, just go slowly and make sure you don't hurt them. And lastly, one of the, actually I'll show you a really cool move, but you want to make sure to, like I said, build your relationship up, make sure the client is always comfortable, talk to them, you know, make sure they know what you're going to do. You know, in general, if, you know, for a pregnancy client, if they're hurting, they're usually pretty comfortable with you working, you know, what needs to be worked on. Just make sure you communicate. So I like to get to the IT band and quads in this position. You know, I don't want to dig on the IT band, obviously, but you know, some of them will get knee issues. So you can kind of go across the IT band. What I like to do is don't dig onto it, but once you get past the IT band, just sink in. Sink in, depending on the client, you know, and then, like I said, we always need to communicate how far they're okay with you going up, you know. Yeah, just kind of working that out like that. Does that feel pretty good? Benefit of working in a massage therapy place, you get massages. And stay tuned. I'm going to show you all a really cool technique in a minute right after this one. Not that they're all cool techniques, but one I recently learned for how to work on the groin on a sideline position. So, and don't be afraid to, like I said, if you communicate well, work all the way up into the front of the hip flexor. They get a lot of issues in there.
Got a lot of weight up front.
Just a lot of weight up front. Can you see how I'm doing it, Brittany? If you need to, you can come over here. Brittany's our camera lady. She's getting better and better each video. Another way I like to do is you can use your forearm all through here, go across. Just be careful when you do it. Use some leverage if you want. You can hold their foot so they don't run away. I always say there's a good pain and there's a back off pain. If it's ever too much, just say something. Try to get all the way up into there. And there's a lot of upper body and all, neck and all that, those good techniques for prenatal sidelining as well, but we're focusing mainly on lower half. She might be lopsided after this though, because I'm only working her right leg. All right, like I said, there's a way to actually work the left side and the groin. Now I'm going to show you on the right. It's going to have to be on the other leg because that's the only way to get to it. But what you do, and actually it is important to get both sides, because if your right leg tends to be your action leg, so you tend to put more weight on your left one. So you're going to get a lot of tension on that left side. But here's how you do it. So if you want to come on this side, Brittany, you tuck the sheet like this. Now, and like I said, maybe not the first time you work on them to do this, but build the relationship up. Offer, these are certain techniques I can do, and make sure they're comfortable. But what I like to do, you get right here to the groin. Some of this, you're kind of flying blind, so you don't want to go too far up or anything, but still it's good technique to get to the groin. You can even use, I like going across the muscle, cross fiber. Helps release it real good. Does that feel good? Tickle? Hands are cold. Normally, no, I make sure they're a little bit warmer. She'll say that, no, he doesn't. But, it is December right now, or January right now. Kind of working it like that, and then you can kind of get your forearm and go across. Good. How does that feel?
Good. It's ticklish.
Not as ticklish with the forearm. Anytime you have a client that is ticklish, use a broader area, maybe your fist or your forearm, or even if you're hitting a target area with your finger, put your hand over it so that they're not as ticklish. All right. Now the QL one I talked about earlier, I will attempt on her, but I'm not going to do it as deep as I would if it were a client that was not pregnant. But basically you would put your ulnar blade like this through their hip and just kind of sink down and in. How's that feel?
Good.
Okay. Because a lot of times with their right side specifically, they tend to hike their hip up a little bit higher, so we want to have them take deep breaths, and this will help release that. I actually had one client recently that said, as I was telling her to take deep breaths, she goes, "No, I'm not dumb." If I take a deep breath, you go deeper. It was really funny. So, all right, yeah. If you don't mind, thanks for watching this, and I hope you have lasted this long. I hope you know, if you would subscribe, that really helps our business. Comment, you know, you can always follow us on Instagram. If you're in the Atascocita, Texas area, and you'd like to try out one of our massages, or you know, we have a team of great massage therapists that can take care of you. All right, and please like this video as well. I hope you have a great day, and thank you for watching. Hey everyone, I'm Tim, owner of Natural Forces Massage. Today I'm going to go over some therapeutic prenatal techniques that I like to do, just to give y'all some more options. One of the number one complaints I hear from prenatal clients is that, you know, their therapist was afraid to touch them. You know, they're not fragile. They can be, you know, you don't want to do a super deep tissue massage, obviously, but there are some good trigger points and stuff like that. So let's get started. You know, as was nice, I put some a hot towel on her back because, you know, I know some people think that you can't put heat on prenatal, which isn't true. You don't want to put it throughout their whole body at once because that can cause a lot of inflammation. And that's where I get started. I wanted to ask you guys, if you don't mind, please subscribe to this channel. Hit the red icon below. You'll see some other neat tricks and tips on other stretching. First thing we're going to do is warm up. So she's in one of the, I can't say her name, so her name is anonymous. So how far along are you now?
21.
21 weeks. Okay. We have this nice prenatal pillow that allows you to lay on your stomach. I do recommend it because it does I've had a lot of clients feel like they're floating in a way. And it's the first time they can lay on their stomach in a long time. One thing I like to do is a lot of trigger point work. Just make sure if you're doing trigger point work that you wash out the muscle really good after. That way it doesn't get, you know, cause any swelling or discomfort later. And also different clients have different tolerances. Like if she's been getting massages a lot, even before pregnancy, her body's used to it. So she might be able to handle a little bit more. But if never had a massage, well, probably wouldn't start out too deep on her. I usually say if it's ever like over, because on a normal client would be maybe over a 7, you know, if they can't breathe through it and stuff. This one specifically, I don't want anything over a 5, you know, in pain. But right now we're just warming up the muscle a little bit. We're going to jump right in though. So first thing I like to do is make sure you hit some shoulder blades. You can go on top of these shoulder blades right here and here. You'll find some trigger points. Remember, a lot of times when through pregnancy, their front gets bigger, which means everything's going to pull forward more, so it's going to be pulling on these back muscles a lot. Well, that means this is going to be a little sore. What I like to do is put one hand over my thumb, and that way I can get a trigger point. And if I'm going too deep or anything like that, like I just saw her jerk a little bit, I might lighten up a little. She's not the one that usually likes too much pressure, but I do have some clients that, you know, prenatal that, you know, like a little bit more pressure. So I'd recommend, you know, when you start doing this on a prenatal client, say, hey, the first time we'll go a little lighter to medium pressure, and we'll see how your body tolerates that. If it tolerates it pretty well, then we'll go ahead and get in a little deeper. Next time, build that treatment plan and that, you know, work with the client. So now, a lot of therapists don't know how to actually get to the pectoral muscles and from face down. There's actually a good way. I know right now she's like, dang it, I thought I was going to stay face down, no pectoral work. But what you do is if you want to come around here, Brittany. I'm going to borrow this arm. What I tend to like to do is do it in this position. I can slide under the shoulder into the pec major and do some work through there. And just kind of hit some of those points and kind of rotate our arm. A little passive release technique. Just to help release the shoulders. And then you can come on the other side and go under the pec minor. But remember, that one's a little bit more tender and you're not able to see this as much, but I'm using this part of my fingertips, not the pointy part, because, well, I don't want to make her mad. Just kind of get in there. And now this will, some light trigger point work, help release the front of her shoulders. That way, this stops pulling so hard on her. One thing I always stress to my therapists that work for me, definitely after if you do something that they don't usually like as much, make sure you do some nice stuff after. So I like to always include the neck. You can kind of run your fingers up through the neck. Now, some people may wonder, okay, can you use elbows on a prenatal? Well, I'm not going to just do this to her. I mean, that would, not make her very happy. But what you can do, as I'll show you, is kind of line your arm up against the spine, not on the spine, but just against it, and focus on their breathing. That way, they start taking some really deep breaths. It might be a little too much, but I'm keeping one thing that controls the amount of pressure your arm is how high my hand is. So if I'm way up here, I'm going a lot deeper. If I'm way up here, I'm a lot deeper than that, but I'm not going to do that to her. So just kind of guide my way through. Like I said, not deep tissue. The deep tissue would be if I was dragging the elbow through. Instead, I'm releasing, sliding, pressing, letting her breathe through it. And then releasing, slide, and when I slide, I don't go too deep. I'm going to be pretty controlled. Make sure you go all the way through the front. And then, a lot of your techniques that you normally do on other clients, you can still do on prenatal. You can do some light stretching on them. One I like to do is connect under elbows and just lean back. Nothing intense. And then you can remember, if you like this video, please hit like, comment below if you have any thoughts, suggestions. I love learning too, so I think us as therapists have to help each other. And I use the tips of my knuckles right in here. I don't dig right straight down, but just kind of going across. And you can do a gentle pull, and we'll put her back. Now the next thing we'll hit on is, I'm going to hit on some lower back stuff. That's how I do my upper back stuff, but I want to show how I do my lower back, because a lot of chief complaints that prenatal gets is as the belly gets bigger, it starts pulling on the back a lot harder and stretching out the ligaments in through here. So we want to help release the tension in lower back and the glutes and all that. So now when they're further along, remember, judge it based on your client, but what I like to do is I don't like to push straight down towards the stomach. I want to push more down towards her glutes. And what I do to apply the right amount of pressure, I put my palm over my fingers and guide down. Don't be afraid to get near their spine, just push the tension away a little bit. Now, one way I find that really releases the tension through their hips and an SI joint is actually what I usually do for clients is definitely as a pregnancy happens, I like to pull their leg out for them, even though sometimes they'll try to help. But the further along they get, they may not be able to. So I'm going to find her leg somewhere. Hang on. All right, we got a leg. All right, so what I do is I'll grab the inside of her knee and I'll slide out. Now, she's very helpful. She's helping me out. But now what that does, when I can put weight down, straight down, it's going to open the pelvis and release some of that pressure through the front. So now in my typical prenatal massages, if the client is comfortable with it, I'll go under the sheet with glutes. Just for this being on YouTube and stuff, I'm not going to do that on this one, but I'll show you kind of the areas I hit. What you can do is like I said, I'm not pushing straight down, I'm pushing out towards her hip, getting the don't be afraid to actually go on top of the sacrum and just kind of push the tension away from it. Because a lot of times they'll get a lot of swelling through here, which causes the nerves to kind of be on fire. Like she just said. She confirms. One thing, oblique and through the QL over here, make sure you get all that. If you feel you can't get enough pressure through with your hands, you can put, like I said, a lean. This is really good for also even if they're not pregnant, you can get even deeper with, usually we'll line my forearm across it, but for the sake of this video, I'm not going to do that today. But what I like to do, so this is the really important move because like I said, it does open their pelvis up and eases that tension on the lower back. Now, you got to be careful though. Make sure you communicate good with your client. But what I like to do, because the bone's right here, I want to get my forearm blade, the ulnar blade, along that bone. So it can be a little tender. And what I'm doing, I'm not pressing straight down towards her stomach. I'm actually connecting right next to the bone and then pushing out toward the hip and actually towards the piriformis. She may even feel a little bit of a stretch in her groin, but
feels good.
See, it feels good.
Because I have that thing that pulls from here to here.
Yeah. This one usually, like I said, it's an amazing technique for glutes, hips, sciatic. A lot of pregnancy clients get a lot of sciatic issues. Remember, I'm doing trigger point, not deep tissue, so what I'll do is I'll usually find one of the trigger points. Different people do trigger point different. Some people will just hold it for 30 seconds. I don't like that method. I prefer just you kind of hit a point, release, and then push again, kind of holding it maybe 5 to 7 seconds, release, and then do the same thing. Kind of like you're pumping the blood. And then walk your way down. And one thing, ask your clients if they're okay with glute work. Now, and make sure you explain to them why, and definitely if they're pregnant, because this is all good stuff for them. And I'll also have a prenatal stretching video on here. You can check out, there's some techniques to also align the pubic bone. There's some good hip flexor stretches that are safe to do during prenatal, during pregnancy. And then I'm going to come over here on that side. Actually, you're going to do a whole circle around. Come on this side for me. So, what a lot of therapists I see miss is actually doing the front of the leg. So, a lot of hip flexor, quad issues, you know, I like to use my forearm kind of as like a windshield wiper. I'll start here and go across. When I get to the IT band, I'll lighten up and then I'll push down through the rest. And you'll see. And try to get all up in here too, if you can see where I'm at. A lot of massage schools, they seem to stop where the leg here, and they only do this part of the leg, and it's kind of annoying because the leg keeps going, and there's a lot of other therapeutic stuff that needs. Just make sure you're communicating good. I'm using a fist. I'm not really pressing too hard right now. I'm just doing a little bit of pressure. And then, like I said, I'll do a windshield wiper move. Yes, I'm patenting that term now. Not really. And going across. And I'll do it again. And then up here is a really good one. Might be a little tender. Also, if you guys want to follow us on Instagram, we're on there as well. Just look Natural Forces Massage. Get some of that tension out of there. And then I'll like to come under now. And remember, I'm not going to push forward into towards her belly. I'm actually going to push kind of at a diagonal across this way. So I want to find that piriformis. Really communicate with them if they ever feel it in there. Any pressure or anything like that. Like I said, you're building a relationship with these people, and you want to make sure to, really make them comfortable to say things to you because you're doing more therapeutic, Okay. And we'll bring the leg back. And here's some more good techniques. If you want to come on this side, Brittany. Brittany's our camera lady. So, I'll start working the hamstring some. Another area I find that some people don't do is work on the groin muscles. And there's a lot of good ways to do it, and a lot of people, if it's just a relaxation massage, sorry, my tongue got tied, but just a relaxation massage is one thing, but they're in pain. Usually as long as you communicate, they're pretty comfortable with what you do as long as you get them out of pain. So I've broken up a lot of just kind of warming it up. I like to push on top, one hand on the other, that way I can control the amount of pressure. Do a little hamstring release. You can use your fist and down. Good for knees too. And down. And remember, the leg doesn't stop here. You keep going all the way up here and down. And down. All the way through the glute. But what I was saying about the groin, good way to get to it. There's a few ways, and I'll show you both ways that I like. This is one way. You can sit on the inside of the table, right through here. Get some lotion on there. Like I said, it's all about communication. So whatever they're comfortable with. So I don't press with my elbow. I'm more blade right here. And I'm doing trigger point. Remember, I'm not doing deep tissue. I'm not dragging my forearm through her groin because I don't want to be kicked in the face right now. But I'm doing more trigger point. Walking not walking, but more of a slide to the next spot. And just communicate. You know, you can kind of go to their comfort level and comfortability, how high they want, because the muscles keep going up and there's a lot of release that needs to be done. Same thing. The other way I really like to do the groin, and this video is not about the what not to do in prenatal, what's not safe, this is more for therapeutic techniques. So if I did want to do some calf and feet work, obviously, I would just kind of do a little bit of that. You can just do a decent stretch. And I would normally do some feet work, but for the sake of the length of this video, I want to get to the other important stuff, more important stuff. So the other way to get to the groin, I love this technique. It's really good for lower back. So what I'll do, and I can actually, I don't know if y'all be able to see the leg with the blanket on top, but you can do it with them covered. So here's her leg. What I like to come on this side. Now I'll sink down in between the legs and then up into it with my forearm. And again, down and up. Maybe pretty tender. And one more good one way up here. Usually, does that feel pretty tender? Or not too bad? She's out. No. Oh, yeah, I don't think she's known. I was talking to her.
Not listening.
Okay. Was that a little tender in there? No? Usually it can be tender, it can feel kind of good. But,
That's my angry side.
It's her angry side, so. Just kind of breaking that up a little bit. If you can't get a good view on that side, you can come on this side, but I don't know. Just like this, slide down, up, like that. All right, and then, let's see, we'll do one last thing I like to do for stretching. I'll just do a little bit right here, but as far as stretching goes, I prefer to do them on their side, but for the hip flexors. Now you can do a simple one, just fold it straight over, make sure they're not feeling it in their lower abdomen, not putting pressure on the stomach. Do you feel the stretch? Mm-hmm. Okay.
No pressure.
No pressure, see. Now you can up this, and the way to do that would be to come under, hold their leg like this, and then you would push, don't push this way towards their stomach, push down. Now, if you feel any pressure, you tell me. Hey, we're just gonna go up a little bit, tell me when.
Okay.
Where do you feel that?
Up my leg.
Upper leg, okay, well, she's feeling in the right spot. Okay. Well, those are a few techniques that I hope y'all liked. If you did, please hit like, hit subscribe for more. Check out my other prenatal video. Leave comments, let me know what you think. If you have suggestions, anything like that, it'd be beneficial from my side too. I can learn as well. We're all in this together as therapists. Thank you so much for watching today, and I hope you have a great day. Hey everyone, I'm Tim. I'm the owner of Natural Forces Massage. I was approached with a question on one of our stretching videos. If you see where it's at the end of the table and we're doing some really deep stretching, if we could do this on prenatal. And the answer is no. You don't want to do the really deep stretches on the prenatal. It's not, they can't recover as fast. Now, this is Michelle. She's one of our therapists here at Natural Forces Massage. She is 36 weeks pregnant? 33 weeks pregnant. So on these stretches, you always want to make sure they're comfortable at all times. When you start doing the stretch, you're going to go to right where they feel it, and you don't want to do anything that's actually feels like they're pulling on their stomach, you know, so as you'll see in this video. So here we go. The first stretch we're going to do is a hip flexor stretch, because a lot of prenatal, whenever your belly is stretching, it's pulling on your lower back. So we're going to kind of reverse some of that a little bit. I mean, obviously you can't reverse pregnancy, but we want to reverse the pull on it a little bit. So here we go. And this, my clients that get this, they get a lot of lower back pain. So this is a really, really good stretch. So what I'm going to do is, you're going to sit right behind their hips. So if you need to see where my position is on the leg, you can come over here. So here's how I'm holding her, and I'm putting my weight into her glute and going back. Michelle, I want you to tell me right when you feel it. You should feel it through here. Right there. Okay, she already feels it. Okay, so at this point, I'm going to just bend the knee a little bit more. Feel a stretch? Mm-hmm. Okay, where do you feel that stretch?
Where I'm supposed to.
Oh, right where she's supposed to, so that's good. Now, sometimes if they're feeling it way up here, it might be a little too painful and we don't want to do it. But it's really good if they're getting it right in their quad, hip flexor area. Okay? And I'm going to go ahead and do the other side too, so she's not imbalanced. So go ahead and rotate the other way. Same thing. I'm going to sit behind them. I'm going to lift her leg, hold her like this, lean into her hip, and pull back. Right till where she feels it. Tell me when.
Right there.
Okay, don't bend the knee yet. Right where she feels it, so I'm going to just bend the knee now. Same area you're feeling it before?
Mm-hmm.
Okay. The pressure I'm putting into her hip too is actually making it deeper into the hip flexor. So don't just sit right here and bend the knee. You want to actually put some weight into the butt. Yes, I know I said butt, but some people don't know what glute means. When I went to massage therapy school, I had no idea what glute meant. But I was also 19, so. Alright. The next thing I want to do, so I'm going to have them lay on their back. How are we doing so far?
Good.
Okay. So there is it's called a pubic symphysis test. It helps align their pubic bones. A lot of these get overstretched and misaligned, which can cause a lot of maybe sciatic pain. It can cause groin pain. It can cause lower back pain. So what we're going to do, this is going to help align them. This can also be done on people who are not pregnant. So, but really beneficial for someone who is. So you're going to put your arm, and you don't want to put your elbow right in their knee. You want to kind of sink right here and have them connect and squeeze together. And as they're squeezing, you're going to rock them a little bit. Okay, just squeeze hard as you can. Oh, there we go. All right, is that uncomfortable? Are you okay? All right, good. This one usually feels pretty good. All right. This is also a good way to test if their groin or their hips are stronger. So the next part, you're going to kind of hug their knees and pull them apart. Okay, so she's actually a lot stronger this way, it seems like. And relax, good. Again, this helps with the ligaments that are in the sacrum and takes some of that lower back pain away. So go again. All right. And relax. Last thing we're going to do is the hamstrings. Probably don't need too much of a hamstring stretch, but now further along in pregnancy, obviously we may not be able to get as far. If you're not too pregnant, you always want to go to the barrier where you feel it. You know, you never want to push yourself too much on the stretches. So you just tell me when you feel it. And what we're going to do, so obviously I can't push too much toward the belly, so I'm going to come a little bit out and then go up. You feel it at all? No? So she's just a gymnast. So she's pretty good. She's pretty good on this. So she passed the hamstring test. So if you want to also do, if you want to make them feel it a little bit more, we can do this. And if you can have them pull their glute down to the table. There we go. You can do this on a bed, or even you can do this on the ground, whichever. Can you feel that a little bit more?
Not really in my hamstring.
Yeah, more up here. So she's tighter up here, but again, a lot of times they get swelling in their calves, cause a lot of issues. And she's shaking her head. Yeah, I do. So, all right. Last but not least, we're gonna do a really good one for the hips. So, again, on some of these hip stretches, I usually go across, but I don't want to go across her belly. So instead, I'm gonna go across this direction, and I'm gonna kind of hold her down and go. You can tell me when you feel it. No, just go slow. Everything's slow. Nothing rushing. You don't want anyone to get hurt. You feel it at all?
Yeah.
Okay. Now, when you get to right where they feel it, what I would suggest you do is have them actually resist it. So bring your knee towards my hand. Feel a little bit more. You're good. Good. All these stretches are really good, even if you're not pregnant. Like I said, you can do these to each other. And I said last, but I do want to do one more. What I want to do: reach around. Grab the hamstring, don't grab the knee, and lean in, and just a little, just to where they feel it. You don't want to go push anyone too much. And if you're a therapist out there, the first time you do this to a client, maybe not go, just go to their comfort level, and they'll come see you the next time, and you'll know how they reacted to it, and then you can see if you can go any further. It's all about building that relationship up. So, all right, how we feeling?
Good.
All right, I guess I gotta do this side, but I'll do that off camera. All right, thank you so much for watching our videos. Please hit the link below and subscribe to our channel, and y'all have a wonderful day. Hi everyone, I'm Tim. I own Natural Forces Massage, and this is Tina. She's my massage therapist here, and she's going to be playing the role of prenatal today. She is not pregnant, but, and I'm saying that because, in case, we don't do something correctly. She's not actually pregnant, All right, so what we're gonna, and the reason I started her face down right now, because I want to show, this video is more on face up stuff, and I wanted to show y'all how we get them to face up from this position. So what I tend to do, now everybody may want to do this differently, but I do it this specific way, is I will drape over them like this, and then have them go onto all fours. When they go onto all fours, so go ahead and go onto fours. So they're covered like this. I don't know if you can come around a little bit, but don't be peeking. All right, so I'll actually, after she's up like that, I will slide that out just like that. And then now, if she were pregnant, she'd have a belly there, so she would start to turn as I did that, and then go to her back. And I could even go to sideline techniques and first, and then do the face up stuff. So when they are, here, what I'm gonna do, we gotta make her pregnant real quick. So she's gonna this pillow's gonna play the role of baby.
There we go.
There's a funky looking baby you got going, but whatever. And now it's going all the way to your chest.
Teacher.
All right. Don't we love teaching? So in this situation, I'd like to, depending on how long you're going to have someone face up. So if I was only going to, spin them around for about, 3 to 5 minutes, I might not put a pillow under their hip, depending on how comfortable they are or how big the baby actually is. So, but the reason we do put a pillow under their hip and kind of tilt them a little is because there's the vena cava, the vein, and it can get compressed and then limit blood flow to the baby or to the mama, and that never goes well. So what I'm going to go ahead and do is get a little pillow. We're going to slide it under her hip. That way she's tilted a little, and sometimes I'll even let them adjust the pillow because it's their comfort, not mine. So, are you comfortable?
Comfortable.
Okay. She sounded so confident on that. All right. So, now we got her. Now, why do I want to do face up? I like to do face up because one, a lot of clients don't like to stay face down the entire time and then them get up and then their face feels like it's been compressed for so long. Two, there's ways I can get to headaches, working the head, working the jaw. A lot of them get real tense in there, working, the neck. I can do some more neck stretches. I'll show y'all in a little bit. And then, hit some hands, arms, pecs, a little bit more efficiently. And then also, as you've seen in the previous video, or if you haven't seen it and you're watching my YouTube channel, there's another video I have that is a pelvic alignment, pubic bone symphysis alignment technique. So, which I might go ahead and do today as well. So, in this video, if you're taking my course, then you've already seen this video as far as the pubic symphysis. But what I like. So a lot of clients that are prenatal get headaches. That could be from stress. It could be from dehydration. It could be from, poor circulation. It can be, numerous reasons, or it could just be because they're stressed out from their husband or something, or their boss. So we're gonna work their head a little bit. Tina, you get any headaches?
Mm-hmm. Every day.
Every day. So, I don't know if y'all know any jaw work, but we're going to work around the temples a little bit. We'll pull and hold and release. This is why people work for me, is so that they can get massages during videos. Another aspect you can actually see, if you look close enough, Trinae will come over here. Her left shoulder is actually climbing up into her neck a little bit higher than her right one, and that can only be seen sometimes when they're face up. So it teaches me a little bit about what to do in that situation. So we're going to work the jaw. Usually it's because the right side's being pulled on, which causes the left to raise up, The tender?
Mm-hmm.
Good tender or bad tender?
It's fine.
Okay. Just a little bit. It's real tight in there. So I'm going to grip right in there and pull. Any migraine sufferers, say that word 6 times in a row. All this generally gets real tight, or if people talk a lot, or chew gum a lot. We'll even show y'all a cool traction move. No, I'm not talking about a chiropractor move. Don't worry, Tina. I'm not going to pull your head off. She ain't ever scared. It's like, I'm just happy to be able to get a little massage. So you can work all around the ears a little bit, under the occipital ridge. If you ever get into the occipital ridge, you can kind of lean them into it and then have them turn away from it, and they'll help release that a little bit and back. Remember, in prenatal, anytime you hit a trigger point, we want to spread out that blood flow a little bit. Does that feel good?
Mm-hmm.
I don't know if she's saying that just because, for the sake of my video, so it looks better.
Mm-hmm.
Or which if you are, thank you. So I can roll them back the other way and do the same thing get under that occipital ridge. One of the things, you want to utilize their body a little bit so that you don't have to hurt your hands. And turn your head to the right a little and let go. I think I just heard Trinae's stomach.
I was about to
You
say something back.
mean your pillow?
Yeah.
All right, I don't know if y'all know the myofascial release in the neck. If you bring your fingertips under like this, can you zoom in on that? We can come under her occipital ridge, raise her up, and we'll just let her guide her head down. Usually feels really good. My mom used to always ask me to do that to her. And then I'm going to go a little bit more to the outside. So I started right next to the spine. I'm working a little to the outside. That should feel pretty good. So when one of the things with prenatal massage, you want to make sure to have open communication, definitely when you turn them face up. If I do face up, generally it's not going to be over about 10 to 15 minutes face up. I mean, that could be a variety of reasons as far as how long, and how comfortable they are. So you really want to make sure, they're not feeling lightheaded or, any tingling sensations.
Feeling just fine. Thank you.
I was going to say, how's the baby do it?
Fluffy as ever.
You can hook your fingers by the spine. People tend to like this a lot. Just come right it up and pull and push at the same time. Hey, not too often you get paid to get a massage, do you?
I'm gonna enjoy every second of it.
Trinae is our videographer, so I want to thank her. She didn't want to play the role of prenatal client today, but I don't blame her. See how I'm kind of hitting those points and rolling her into it? Those usually feel pretty good. And same thing. All right, one good stretch technique you can do. Lift their head up. You're going to slide your arm under to here. So they're going to turn their head towards my hand. And then I'm going to compress right below the clavicle and stretch. That feel pretty good? And back just to the point of resistance, especially with prenatal. Prenatal clients do not recover as well from stretches. So if you overstretch them, they're going to come back the next day and be very upset with you. And then a good way to transition that, you can just slide the other one under. Same thing. Good. One neat little technique I've seen, a way to do traction, you can slide your forearm under here, put your forearm on top, and just turn. You feel the traction a little bit?
That feels good.
Definitely if they have any like herniated disc or bulging disc, this actually does very good for that. So. And the other thing I'll show you all. One thing, remember with prenatal, well, actually, I will say with any client that's a female specifically, always get permission to work on their pecs. I usually explain why, and the reason we work pecs is to help open the shoulders up. You know, we live in a rounded shoulders society, so good to kind of push and pull all the way through the clavicle, under the clavicle towards the sternum. Is that okay?
It tickles.
Oh, it tickles. Okay. One thing you can do when they are ticklish is just to apply a bigger body part on that part. So I could do a forearm or a fist and just compress. So if I just do that.
I think it's because it's tight.
Oh, well, that would be too. So is that less ticklish though, like that? Okay. And you can push and pull at the same time. Does that feel good? Good. And you can do that with your palm as well. For her, I'll go ahead and do the other side. That way she doesn't feel a little lopsided. Remember, when you do the pecs, you hit the pec minor and major. The major's on top, the minor, and they connect in different places too, but I'll show you all in a minute. So with major, it controls internal rotation like this, and then the minor actually pulls down. So a lot of people, they're right-handed, their right pec minor is gonna be tighter, which is pulling their right shoulder down like this. So if you release under the pec minor and through here, where it connects into the coracoid process, that will help a lot. If I need to pause so that y'all can Google coracoid process, that's fine. It's okay, I looked up the word before I did the video, so. Is it all feeling pretty good now? And you can do the hands, forearms, arms, and all that if you want. But what I do want to do is the pubic symphysis alignment. I'm just putting this bolster out. So when they do this, they're going to bring their knees up, and we're going to open them up. There we go. You can do this at any stage of the pregnancy. Usually those ligaments are getting stretched out too much, so we want to put our arm right in between. Don't put your elbow into their knee as much, more down a little bit lower, and then have them squeeze together hard as they can and relax. Okay, so next, when I could tell how hard they squeeze, what I'm going to have her do is do a little bit of a bridge. So squeeze and lift your pelvis just a tad. There you go, and just squeeze. And if they squeeze sometimes a little hard, too hard, it can cramp their hamstring. So don't allow that to happen. So communicate that beforehand. Okay. All right, I think that about covers everything. You know, she's gonna just take a nap the rest of the day. So I hope y'all enjoyed this. Please leave a comment on your thoughts. Thank you for watching, and please hit subscribe. Have a great day. Hi everyone, I'm Tim. I own Natural Forces Massage, and this is Tina. She's my massage therapist here, and she's going to be playing the role of prenatal today. She is not pregnant, but and I'm saying that because, you know, in case, you know, we don't do something correctly. She's not actually pregnant, you know. All right, so what we're gonna, and the reason I started her face down right now, because I want to show, this video is more on face up stuff, and I wanted to show y'all how we get them to face up from this position. So what I tend to do, now everybody may want to do this differently, but I do it this specific way, is I will drape over them like this and then have them go onto all fours. When they go onto all fours, so go ahead and go onto fours. So they're covered like this. I don't know if you can come around a little bit, but don't, you know, don't be peeking. All right, so I'll actually, after she's up like that, I will slide that out just like that. And then as there, now, if she were pregnant, she'd have a belly there, so she would start to turn as I did that and then go to her back. And I could even go to sideline techniques and first and then do the face up stuff. So when they are, you know, here, what I'm gonna do, we gotta make her pregnant real quick. So she's gonna put, this pillow is gonna play the role of baby.
There we go.
There's a funky looking baby you got going, but whatever. And now it's going all the way to your chest.
Teacher.
All right. Don't we love teaching? So in this situation, I'd like to, you know, depending on how long you're going to have someone face up. So if I was only going to, you know, spin them around for about, you know, 3 to 5 minutes, I might not put a pillow under their hip, depending on how comfortable they are, or how big the baby actually is. So, but the reason we do put a pillow under their hip and kind of tilt them a little is because there's the vena cava, the vein, and it can get compressed and then limit blood flow to the baby or to the mama, and that never goes well. So what I'm going to go ahead and do is get a little pillow. We're going to slide it under her hip. Oh, that way she's tilted a little, and sometimes I'll even let them adjust the pillow because it's their comfort, not mine. So, are you comfortable?
Comfortable.
Okay. She sounded so confident on that. All right. So, now we got her. Now, why do I want to do face up? I like to do face up because one, you know, a lot of clients don't like to stay face down the entire time and then them get up and then their face feels like it's been compressed for so long. Two, there's ways I can get to headaches, you know, working the head, working the jaw. A lot of them get real tense in there, you know, working, you know, the neck. I can do some more neck stretches. I'll show y'all in a little bit. And then, you know, hit some hands, arms, pecs, you know, a little bit more efficiently. You know, and then also, as you've seen in the previous video, or if you haven't seen and you're watching my YouTube channel, there's another video I have that is a pelvic alignment, pubic bone symphysis alignment technique. So, which I'm gonna go ahead and do today as well. So, in this video, if you're taking my course, then you've already seen this video as far as the pubic symphysis. But what I like, so a lot of clients that are prenatal get headaches. You know, that could be from stress, it could be from dehydration, it could be from you know, poor circulation. It could be, you know, numerous reasons, or it could just be because they're stressed out from their husband or something. Or their boss, you know. So we're gonna work their head a little bit. Tina, you get any headaches?
Mm-hmm. Every day.
Every day. So I don't know if y'all know any jaw work, but we're gonna work around the temples a little bit. We'll pull and hold and release. This is why people work for me, is so that they can get massages during videos. Another aspect you can actually see, if you look close enough, Trinae will come over here. Her left shoulder is actually climbing up into her neck a little bit higher than her right one, and that can only be seen sometimes when they're face up. So it teaches me a little bit about what to do in that situation. So we're going to work the jaw. Usually it's because the right side's being pulled on, which causes the left to raise up, you know. The tender?
Mm-hmm.
Good tender or bad tender?
It's fine.
Okay. Just a little bit. real tight in there. So I'm going to grip right in there and pull. Any migraine sufferers, say that word 6 times in a row. All this generally gets real tight, or if people talk a lot, or chew gum a lot. We'll even show y'all a cool traction move. No, I'm not talking about a chiropractor move. Don't worry, Tina. I'm not going to pull your head off. She ain't ever scared. She's like, I'm just happy to be able to get a little massage. So you can work all around the ears a little bit, under the occipital ridge. You ever get into the occipital ridge, you can kind of lean them into it and then have them turn away from it, and they'll help release that a little bit and back. Remember, in prenatal, anytime you hit a trigger point, we want to spread out that blood flow a little bit. Does that feel good?
Mm-hmm.
I don't know if she's saying that just because, for the sake of my video, so it looks better.
Mm-hmm.
Or which, if you are, thank you. So I can roll them back the other way and do the same thing on. Get under that occipital ridge. You know, one of the things you want to utilize their body a little bit so that you don't have to hurt your hands. And turn your head to the right a little and let go. I think I just heard Trinae's stomach.
I was about to say something back.
You mean your pillow?
Yeah.
All right, I don't know if y'all know the myofascial release in the neck. If you bring your fingertips under like this, can you zoom in on that? You can come under her occipital ridge, raise her up, and we'll just let her guide her head down. Usually feels really good. My mom used to always ask me to do that to her. And then I'm going to go a little bit more to the outside. So I started right next to the spine. I'm working a little to the outside. That should feel pretty good. So when they're, one of the things with prenatal massage, you want to make sure to have open communication.